Ed here. Welcome to another edition of Ed Talks. I love to feature great leaders, as you know, but also people who have a really significant why, like what drives them? Why are they so passionate? And Rahul is one of those individuals. So, Rahul, welcome to Ed Talks.
Thanks, Ed. Great to be here.
Looking forward to this discussion. For those who might not know you, Rahul, tell us a little about you personally and professionally, and then I want to get into this amazing thing that you've created.
Yeah, sure. So I've grew up in 12 different countries before I moved to the US. Was on the finance track after undergrad and grad school. Got into healthcare in '99. I had an aortic aneurysm when I was 29 and ended up having heart surgery, lung surgery, which made me really appreciate the industry that physicians and services could help my mother, father, brother, sister, uncle, aunt. Coming out of surgery, ended up working for a startup, and then I wanted to be part of the healthcare system, so I decided to go work at Stanford for a couple of years and kind of work at Stanford running strategy and growth for the hospital. And then consulted, and then in 2018 ended up joining Varian on the oncology side to help build services business around their hardware group. And so, been on the vendor side, provider side, did some work with the payers and started California's first HIE. So I've been dabbling in healthcare for the last greater part of 25, 26 years now.
Yeah, that's cool. All right, 12 countries. All right, tell us what's the most unique one?
I think the one I really enjoyed the most was living in the Middle East in the UAE. I think I was in an international school, but it gave me a true appreciation for multiple cultures, building the melting pot, financial capital, and just appreciating what cultural differences how they can strengthen you versus anything else. So that was probably the most interesting part. The funnest part was living in Barbados for 4 years. So
yeah,
that was fun. That was a fun part.
So Rahul, how many languages do you have at least cursory understanding of? Like you could make it through the day?
Probably about 4 or 5.
Yeah.
2 Indian languages, a little bit of French, a little bit of Spanish, a little bit of English. About 5.
Yeah. That's
I
pretty
wouldn't
impressive.
speak you any of them, but you could put me in the street and I could manage.
Now you took a giant pivot in your career recently. And for those who are seeing the visual, you've got WiTT on the logo. We are in this together. Tell us a little bit about this pivot. Like, what is WiTT and how this pivot happened?
Yeah. So I got into healthcare, as I said, because I really want to be part of an industry where the technology, the physicians, the services could help my mother, father, brother, sister, and aunt. In 2021, I was diagnosed with stage 4 prostate cancer. So spent most of 21 as a patient on the other side of the oncology space. And as I went through treatment, I met a lot of patients who were voluntarily choosing to either delay treatment or not do treatment because they didn't have the non-clinical support at home to get them through the journey. And so for me, the pivot happened where I said to myself, patients can't even get to the hospital to be treated. None of the other stuff matters. And so what can you do to address these life challenges that patients face that have a direct impact on whether they can or cannot attend treatment as they go through treatment?
Yeah. And you had this aha moment because you and I have talked about this before. You had this aha moment. Was it yourself getting treatment? And you're like, I'm going to get this treatment and I'm not going to miss any treatments because that's going to lead to a healthy outcome. But you ran into people that were like, well, I'm not sure I'll make the next one. And for reasons that shouldn't exist, but they do. That's reality. Tell us that story, because I think that's a beautiful story into the whole why around WiTT.
Yeah. So when you go for, 29, 30, whatever fractions, and you see the same people every single day, and you notice that somebody isn't there one day, and you ask them, well, why didn't you show up? Why weren't you here yesterday? And one of the patients I talked to said, well, I took the bus from my house to the hospital. The bus didn't show up. So I decided to miss my appointment. And my flippant response at that point was, I should take an Uber, right? And the response was, I can't afford an Uber and I don't have a debit or credit cards. It wasn't an option. And then I met a whole bunch of patients who were voluntarily missing appointments because they had a sick child at home, nobody to watch the kid. They weren't taking their meds because they needed the money to pay for food. And so I'll have to give my daughter credit for this. And she turned 20 yesterday. But when I told her about these stories, she said, I said, but for the grace of God, we have what we have. And we're blessed to have the resources we have, but there's more people out there who don't have the resources we have than do. And so her response to me when I was working at Varian was, why don't you quit your job and start a company to help patients, which is where WiTT.
Yeah. And so tell us the high level, like how this works, the supply and demand.
Yep. So the biggest issue for patients is most patients don't like to ask for help. We don't want to be a burden on anybody else. We don't want to ask people to help us. And so part of the challenge was, how do you build a platform that actually makes it okay for people to ask for the help they need without the guilt of asking? And so we took this idea of the wedding registry or birth registry, where people get married or have kids. There's no guilt in asking. And so we said, let's take that idea and apply it to patients so that a patient guilt-free can ask for the help they need, both financial and non-financial. Let's combine that with the best of crowdsources so you can share that with friends, family, work colleagues. And then let's build a FinTech platform in the back end, because there's a lot of underserved, underrepresented, marginalized patients who don't have access to services like Uber, Lyft, DoorDash, Instacart, and so on, because they don't have access to credit or debit. And so we can solve that debit issue. We can now not only identify what people need help with, but we can actually unlock existing funds that health systems have and deploy those funds in real time to address these last mile challenges that patients face.
Yeah. And number one is all about the clinical care. I know that's your heart as well. We want to see these people. No one should not get healed because of one of these issues. On the second side, from a CFO lens or, financial lens, this makes total sense. This investment that a healthcare system would make to have healthier outcomes in their patients. I think for our reasons we all understand why that would be so important, whether it's a HMO type, ACO type plan or what have you, it just makes financial sense. So number one, the clinical. Number two, there is a financial return on all of this. So Rahul, this is amazing. How do people find out more information? And whatever you say right now, we'll put into the show notes.
Yeah, so they can go to our website, www.witforever.com. And the reason it's Wit Forever is WiTT.com is a company that makes garbage containers in Ohio, I think. And so we just added the word forever to the word. But they can go on the website, see what we do. We white label our platform for health systems. So we really want the product to be a local product for local patients in the local communities. Or they can reach out to me anytime at, Rahul@witforever.com, which is my email address. And I'm happy to share what we're doing with anyone who's interested.
Yeah, Rahul, I think your daughter was onto something that you obviously have the expertise to execute on. Amazing service. We all talk about patient experience and all these different things, and we say it intellectually, but hardly put enough effort into the execution. But with WiTT, you've got the execution arm now. So thank you for all that you're doing. And thank you for being my guest on Digital Voices.
Appreciate it, Ed. Thank you so much for the opportunity to share our story.